You walk into the doctor's office. You know something's wrong. You feel it in your bones, the fatigue, the tightness, the ache that won't quit. But you also know, deep down, what's coming. They won't really listen. They'll smile politely, skim your chart, ask a few rushed questions, and chalk it all up to age. Hi, it's Vernon again. Today, I want to walk you through 7 harsh realities about how seniors are viewed in the medical world, and more importantly, how you can reclaim your voice. In today's healthcare system, aging means becoming less visible. Not officially, but silently, behind the charts and protocols. You're seen as a burden, complicated, too much effort for too little return. Doctors won't say it out loud, but it's there. You're too old for real treatment, too old to be heard, too old to matter. That's the first ugly truth, and it's time we stopped accepting it. If this resonates with you, don't hesitate to subscribe to my channel. Sometimes, all it takes is one shared truth to remind us we're not alone, and that our voices still matter. Let's get honest, let's get loud, and let's start with the quiet assumption that does the most damage, the one made the moment you walk through the clinic door.
You're judged by your age before you say a word. Let's get honest. Let's get loud. And let's start with the quiet assumption that does the most damage. The moment a doctor sees your birth year and makes a decision before you even speak. You see, age triggers something most people don't realize: mental shortcuts. Doctors call it pattern recognition, but what it often becomes is prejudice by habit. They see a number, 68, 72, 83, and their brain pulls up a preloaded file. Fragile, forgetful, time-consuming. According to a study published in the Journal of General Internal Medicine, doctors were significantly more likely to label older patients as less likely to benefit from treatment, even when their symptoms and test results matched those of younger patients. That's not science. That's bias. This is what I call clinical shorthand, where your individuality is erased and replaced with a stereotype. You're no longer Mr. Collins who bikes every morning and reads history for fun. You're just elderly male, 70 plus, probable comorbidities. It gets worse. These assumptions affect everything from the tests you're offered to how much time a doctor spends listening to you. A 2017 study from the University of Michigan found that physicians spent 23% less time actively listening to patients over 65 than they did with younger patients describing the exact same symptoms. That's not science. That's unconscious bias. It's baked into years of training and quotas, but the result is the same. Your care is filtered through a lens of low expectations. My cousin Ruth, 74, sharp as a tack, came to her appointment with a neatly organized journal of symptoms. She had tracked everything: times, triggers, even dietary patterns. The doctor barely looked at it, just nodded and said, "Probably just aging." 3 months later, Ruth was rushed to the ER. What they found should have been caught in that first visit. So, how do you push back? Start by disrupting the pattern. Come prepared with specifics. Use numbers, dates, measurable concerns. Say, my blood pressure was 118/75 until 2 months ago. Now it's spiking by midday. Speak their language, and you remind them you're not just another chart. You're a case worth thinking about. Now, that's just the first shortcut, but there's another, one that's far more insidious. It doesn't live in the brain, it lives in the budget.
2. Your life is weighed against the hospital's bottom line. They won't print this in any patient brochure, but I'll say it here. Behind the warmth of the waiting room and the soft tone of your doctor's voice, there's a machine humming, one that runs on profit, efficiency, and cold numbers. In that machine, age becomes a metric, not of wisdom, not of resilience, but of diminishing return. You're no longer viewed as someone with decades of life still ahead. You're evaluated for what's left, what's worth spending, and what's easy to skip. It's uncomfortable to hear, but in too many cases, your chart is quietly weighed against a balance sheet. Behind the scenes, treatment decisions are quietly shaped by something called cost-benefit analysis. Doctors won't tell you this, but the moment they see your age, some of them begin making calculations, not just medical, but financial. What's the cost of this test? How long would recovery take? How many years would this patient even gain from treatment? It sounds cruel, and it is, but it's real. According to a 2022 report from the Journal of Health Economics, older patients were 32% less likely to be recommended for advanced diagnostic procedures than younger adults with the same presenting symptoms. Why? Because those procedures are expensive, and older adults are seen as less likely to offer a return on investment in terms of years lived. I once sat with a friend, Alan, 76, retired machinist, still working on motorcycles in his garage, after his doctor suggested skipping a biopsy because, at your age, it might not be worth the stress. Alan didn't feel old. He didn't live old. But the system had already decided what his years were worth. This kind of reasoning isn't just flawed, it's dangerous. It robs people of choice, of dignity, of precious time. It also creates a chilling ripple effect. Families start lowering their expectations, patients begin to accept less, and doctors feel justified in doing the bare minimum. But here's the thing, you don't have to accept this quiet calculation. Ask for transparency, request second opinions, demand documentation. Say, would this be your recommendation if I were 45? If not, ask them to explain why in writing. You'll be amazed how quickly vague advice turns into a detailed conversation when accountability is on the table. Of course, money isn't the only factor shaping your care. There's something else, just as subtle and just as harmful. It sounds like concern, but it silences your symptoms. Number 3. Your symptoms are dismissed as just getting older. Let's call it what it is. Medical gaslighting. A subtle, almost invisible dismissal, wrapped in phrases like, "That's normal for your age," or "We all slow down eventually." But here's the truth. Aging doesn't make pain imaginary. It doesn't turn serious symptoms into harmless ones. And it certainly doesn't justify brushing off your concerns. According to research from the American Geriatric Society, 85% of serious conditions in older adults, things like heart disease, thyroid disorders, and even cancers, are initially misattributed to aging before proper diagnosis. Not because the signs were unclear, but because the assumptions were too strong. I remember Carl, my former construction supervisor, built like a tree trunk. For 8 months, he told his doctor about the same things: joint pain, morning stiffness, constant fatigue. And every time he heard the same thing: "Carl, you're not 30 anymore. This is part of getting older." Turns out it wasn't. It was advanced rheumatoid arthritis, and the delay in treatment caused permanent joint damage that could have been prevented. When doctors default to age as the explanation, they stop investigating, they stop being curious, and that can cost you years of healthy life. If you've ever had a moment like this, where you felt ignored or brushed off, tap that like button, not for me, but so this message reaches others who need to hear it too. So how do you break through that fog? Start by bringing a timeline. Describe when the symptoms started, not vaguely, but specifically. Since March, I've needed daily naps when I never did before. Use contrast. Last year, I hiked trails. Now I struggle with stairs. Then ask directly, would this symptom concern you if I were 45? That single question cuts through the assumption and demands medical reasoning, not age-based dismissal. But if you think that's bad, wait until you hear what's being done with medication, not to treat you, but to make you easier to manage.
Number 4. You're being medicated for compliance, not care. Here's a truth no one wants to say out loud. In far too many healthcare settings, medications are being used not to treat illness, but to manage behavior. Seniors who ask too many questions, labeled anxious. Those who advocate for themselves, labeled difficult. The result? A prescription pad becomes a muzzle. Dr. James Martinez, a former nursing home medical director turned patient advocate, put it bluntly. He said, "I've seen anxiety meds handed out to seniors who were simply frustrated. Antidepressants given to those asking about delayed test results. Sedatives for those who dared to challenge sloppy care. It's chemical restraint dressed up as treatment." It's not just disturbing, it's deadly. According to a 2023 review in the Lancet Healthy Longevity, over 40% of seniors are prescribed psychiatric medications, yet only 12% have a qualifying mental health diagnosis. The rest? It's about control, not care. Take Beverly, my old neighbor, a retired school principal. After a hip surgery, she grew frustrated with slow rehab progress, asked a few too many detailed questions. Suddenly she was prescribed anxiety medication to help her relax. Instead, it made her dizzy. She fell, broke her wrist, and spent 4 extra months in recovery, not because of her age, but because of a pill she never needed. And here's the kicker. These meds often create the very symptoms they're supposed to treat. Sedatives can cause confusion. Then that confusion is labeled dementia. Mood stabilizers dull your energy, and that gets called depression. It's a vicious cycle, and it starts with a quiet decision made without your full understanding. So what do? You step into the room not as a passive recipient, but as a partner in your own healing. You ask, not out of defiance, but out of quiet clarity. clarity. Can you help me understand what this medication is meant to treat? What should I notice if it's working? When will we know it's no longer needed? You don't demand, you invite accountability. Because when the questions are intentional, respectful, and clear, doctors listen differently. And that changes everything. Because the moment you start asking the right questions, you become a patient they have to treat, not manage. But medication isn't the only thing quietly shaping your care. There's something even more chilling, a value judgment that decides if your life is worth saving at all.
Your life is measured in years, not meaning. There's a phrase whispered in the corners of healthcare policy meetings, often dressed up in clean academic language: quality-adjusted life years, or QALYs. Sounds harmless enough, but what it really does is assign a number to your future. A number that helps the system decide who gets full treatment and who doesn't. Dr. Patricia Chen, an ethics professor who studies medical rationing, calls it the quiet arithmetic of ageism. She explains that in many hospitals, treatment decisions are shaped by how many good years you have left. Not your will to live, not your spirit, not even your health, but how much time you're expected to have and how useful that time is perceived to be. I remember Walter, a 68-year-old retired engineer, diagnosed with kidney failure. His doctor recommended comfort care, saying dialysis might be too aggressive at his stage of life. Walter disagreed. He pushed back, fought for the same dialysis routinely offered to younger patients, and he got it. Not only did he survive, he got back to gardening, volunteering, laughing with his grandkids. He lived 7 full years they were ready to write off. Have you or someone you love ever been told a treatment might not be worth it just because of age? Share your story in the comments. Your experience might help someone else realize they're not alone. This isn't just about medicine, it's about worth. And when worth is tied to age, the decisions stop being medical and start becoming moral. So ask, would you offer this treatment to someone 25 years younger with the same health profile? If not, ask why. Not every doctor will mean harm, but many have never been challenged to see past the metrics. Because you are more than a number in someone's formula. And if you don't speak up for the value of your life, they'll measure it without you. But this isn't where the story ends. There's still one more truth to face, and it's the one that touches the mind, the memory, and the assumptions that can quietly shape your future before you even notice it. Number 6. They assume you're slipping, even when you're sharp. They look at your birth date and make a silent decision. Keep it simple. Don't go into detail. Avoid technical terms. Speak slowly, gently, as if your mind, not just your body, is showing its age. This is one of the cruelest forms of bias, not because it shouts, but because it whispers. It shows up in tone, in omission, in the assumptions they never question. Dr. Amanda Richardson, a neuropsychologist who studies medical bias, put it plainly. Clinicians often underestimate older adults' cognitive abilities, not because of evidence, but because of expectation. That expectation changes everything. When doctors believe you can't understand complexity, they don't offer it. You won't hear about advanced options, newer treatments, or cutting-edge therapies. Not because they're unavailable,
but because someone else decided you couldn't handle them. A 2021 study in aging and mental health found over 60% of older patients felt underestimated by their doctors, especially in discussions involving complex care. This isn't just about dignity, it's about access. When you're seen as incapable, you're quietly cut off from information and from choices. And the saddest part? Over time, this soft bias becomes a silent agreement where doctors simplify and patients shrink, not because they must, but because they've learned that complexity is no longer offered to them. Because the truth is, your mind isn't slipping, it's seasoned. And when we stop challenging that false assumption, we start losing access to the care we still deserve.
Number 7. You're treated like you've stopped changing. Here's one last truth we don't talk about enough. The healthcare system treats older adults as if growth has ended, as if your body, your mind, and your spirit have all plateaued into some static version of old. You feel it when you speak, and they nod, but don't really hear you. You sense it in the way treatment plans are handed to you, not discussed with you. It's the unspoken belief that people over a certain age don't evolve, that who you are now is all you'll ever be. But that's not how aging works. Growth doesn't end at 60. Self-awareness doesn't pause at retirement. Healing, physical or emotional, doesn't run on a clock that stops ticking when your hair turns gray. The danger of this assumption runs deeper than a misdiagnosis or a simplistic care plan. It's spiritual. Because when a system stops believing you can change, it stops offering you the tools to do so. It stops offering you hope. And the more you internalize that, the more invisible your potential becomes, even to yourself. This isn't about asking for false optimism. It's about insisting that your story isn't over, that the choices you make today, in treatment, in mindset, in how you respond to pain, still shape the person you are becoming. You're not a snapshot frozen in time. You're still a story unfolding. So the next time someone assumes you've stopped growing, correct them gently or firmly, whatever your style. Say, I'm still learning, I'm still adapting, I'm still becoming. Because it's true. And when your doctor believes it, they treat you like someone who still has something to gain, not just something to preserve.
So what do we do with all this? We don't rage, we don't despair, we reckon. We carry these truths not as burdens, but as armor. Because now you know the terrain, you see the patterns, you understand the quiet injustices that too many accept in silence. You've heard the 7 ugly truths, but maybe the most important truth is this: you still have power. Not just over your decisions, but over how the world treats you. Because when you walk into the doctor's office informed, grounded, and unafraid to ask questions, you shift the dynamic. You demand more. And slowly, the system has to answer to that. Seneca once said, "As long as you live, keep learning how to live." So remember that you are still learning, still living, still worth fighting for, with clarity, with courage, and with the unshakable knowledge that your years have earned you the right to be heard, not hurried. So let's keep this conversation going. Share your story in the comments. Have you experienced any of these 7 truths firsthand? What will you do differently at your next appointment? Like this video if it resonated with you. Share it with someone who needs to hear they're not alone. And if you haven't already, subscribe. Not just for more content, but for more clarity, more strength, more tools to age with dignity and power. You are not invisible, and this is not the end of your story. And I'm Vernon. Thanks for watching.